It's great to have everybody here. We're excited to talk about the clinical experience of the ID fellow at Johns Hopkins. When I was applying, I found these videos pretty helpful to kind of get a sense of what the different experiences are. So hopefully people watching these videos find them as helpful as I did. We're going to go around and just introduce ourselves first. I'm Seth. I'm one of the first-year fellows.
And I'm Kate. I'm also a first-year fellow.
Something a little about myself because I'm different compared to everybody else. So I am a third-year fellow, but I'm an infectious diseases and care fellow, which I did the critical care part through NIH and my ID portion through Hopkins. And I'm from Louisiana.
Right, and I'm Gerald. I'm one of the third-year ID fellows. I'm originally from New York, and I did residency at Vanderbilt before coming here. And then I am one of third-year fellows who's going to plan on staying as faculty next year.
We thought we'd just talk about the different services here. I think when you're applying to fellowship, you get a lot of information about lots of things, and sometimes it's hard to keep track of. But I think there's some general themes that hopefully we'll touch on that kind of give you a strong sense of what it's like to be a fellow here. And we're going to talk about the different clinical services that are here. So first of all, we wanted to talk about is the general ID service at Johns Hopkins Hospital. It's known as the MAN service. The services are named after eminent ID physicians of the past. And the MAN service is the service I'm on right now, and it's the general ID service. And you spend a lot of time on that service. And so maybe people could share some thoughts about kind of what reflections of being on the MAN service.
Yeah. I've also spent a lot of time on MAN this year. I think it's like at the main Johns Hopkins Hospital. So it's like a tertiary or quaternary referral center. So you get a lot of very complex patients, and as well as you'll still get some of the just kind of run-of-the-mill stuff. But I would say that's a service where you get a little bit more of like patients who have had really complicated surgical courses or just hospital courses in general, where they've been there a long time, had a lot of different infections or procedures happen to them. So you get a very good exposure to kind of very complicated sorts of ID cases. There's also, a lot of referrals and because there's so many surgical services there, you'll get a lot of patients who have kind of had all of that exposure, in addition to the immunocompromised patients that you'll get more on the Tucker service, which we'll talk about as well. And we'll talk about the Bayview service, which provides a little bit of a counterpoint to the MAN service as well.
And one thing I'll add about the MAN service is that one of the benefits is there's caps for the fellows. So each fellow caps at 3 new patients, typically during a weekday. So after the cap, there's a solo attending who will see consults. And I think that really helps keep the caseload balanced for each of the fellows so they're not overwhelmed. And it gives you time to also attend conference. So I think that's a great benefit of the program as well, where you get to see a broad array of things while also having some protected time for dedicated learning as well.
Yeah, I guess on that same note, we, similar to a lot of other institutions, we do have a solo service at kind of, acts as a pop-off service, if you will. And so, it allows us to kind of have that reasonable number of patients. Not to say that times don't get busy, they do, but I think the fellowship is really good at asking us, if we're able to handle, the consult load, so on and so forth. So I think that has been really helpful. And the MAN service in general, I think is fun in the sense that you get a wide breadth of patient, I guess, clinical presentations. But I mean, you also get, some of that HIV, I guess, patient experience, even beyond what you would get on our HIV service, which is the service.
Yeah, I think echo all of those things. And it's nice, I think, being just from a social standpoint, being paired with another fellow on the MAN service. So there's two fellows to one attendee, and so it's a good way to get to know your co-fellows. And it's nice to have the visiting NIH fellows. There's an NIH fellow I'm working with right now. It's really fun just to get to learn from their experiences too. So that's kind of a nice social element that you get from being on the MAN service is really nice. I also have really grown to appreciate the micro rounds that we do on the MAN service. in times of COVID, a lot of this I think was lost, but now they've returned to in-person plate rounds that we do on Friday afternoons. And it's nice, it's become really nice because you can, if there's a particular culture you're waiting on or a clinical question that you have, you can ask them to pull that and take a look. My most exciting event was on Friday. There was a tick bite. A patient had a tick that the nurse pulled off the patient, and we brought the tick down to the micro lab and looked at it under the dissecting scope. So that was a cool experience. And the micro fellows are really helpful, I think, like in terms of clinical questions and just getting their assistance with diagnostics. So I think I like the collaboration, I guess, that you get when you're on the man service, which is really nice. And so additional services. So at Hopkins, at the main Johns Hopkins Hospital, the other service is the Tucker service, which is the transplant oncology service. People would like to share some thoughts about being on the Tucker service.
Yeah, I can go. I actually just got off the Tucker service this weekend. And actually I really enjoy the Tucker service. I feel like a lot of times the attending kind of sees you as a colleague, not that the others don't, but I mean, I really feel like you are seeing patients together, working through the differential diagnoses together, and you have a lot of ownership of those patients. And they're all fantastic. They, are experts in their fields. Sorry, that's my dog. If you can hear it, I'm sorry. And it's actually a pretty good time. I actually really enjoy the transplant service.
And I think one of the, go ahead, Kate.
Oh, I was just going to echo that. It's kind of nice because you work with the same attendings because it's a smaller group of attending. So by the end of the year, you've kind of worked with most of them, some of them more than once, which is really nice. And they also know the patients really well. So it's a really nice experience from that perspective. And you get to see really cool cases, again, because at Hopkins, there are just, a large variety of like transplant patients and other immunocompromised patients. So you'll kind of get to see a different flavor of ID than on the general service.
Yeah, and I was going to add that I think the great thing is for our immunocompromised service, there's a wide range of different transplants that you'll see also. So at Hopkins, you'll see heart, lung, kidney, liver. So, and then occasionally you'll see some sort of soft tissue also transplants. And then obviously we also have the malignant heme service. And then there they also do bone marrow transplants. So you see quite the gamut and almost all types of transplants. So I think you get a very broad range of experiences while you're here on the immunocompromised service. And I would say most people just doing your day-to-day duties on the fellowship service, you get a very good feel for how to take care of the immunocompromised host. So you'll come out of fellowship very comfortable in that area.
Yeah.
That same note, it's important to note that we do see VADs. Sometimes that goes on to the general service, sometimes on the transplant service, depending on where they are. But not all institutions do VAD infections. So I think that's an important thing to point out.
Yeah, there are VAD infections. I think, just echoing kind of what everyone said, and a theme that I think kind of runs through that's been really strong for me is that there's so much expertise and just clinical excellence within the ID division. It's really inspiring. You look at UpToDate, or you go to look up an article for something and it's written by someone that now. I think that's really a cool experience. There's that, but then people are also just very approachable, and there's just a lot of collegiality when people were talking about it. I think on the Tucker service, I really feel that on Mondays, there's the transplant on oncology. We run the list basically with the whole transplant and oncology ID team, and all the attendings are on the call, and people are just chipping in different thoughts about complex cases. And I just appreciate that you have all this expertise, but people are really approachable about asking questions. And I feel like that kind of, if you have a question about a particular thing, there's someone that you can reach out to. And I think that kind of definitely is something unique that I feel here. So that's the Tucker service. And then so moving hospitals. So Bayview is kind of the sister hospital that we rotate at. And there's the Greenough service that's there, and that's the general ID service at Bayview. And Bayview, yeah, it has a very different flavor and different vibe, and has different aspects. So be curious to hear people's thoughts, about Bayview.
So I'll say Bayview definitely has a different feel. So overall, it's a little bit more of a community feel compared to JHH. So you get to see a lot more bread and butter cases, like a lot of skin soft tissue infection, wound infections, osteo, bacteremia, et cetera. But it helps you familiarize with those typical types of cases. And also, I think one unique aspect of Bayview is that it also has a burn ICU. And that's a really unique experience that you won't get at most institutions. From an ID perspective, you get to see a lot of multi-drug resistant organisms in that setting. So you quickly become comfortable with using a lot of the new novel agents as well. So I think it's a great experience to be there as well from that perspective.
And I think you get a better sense kind of what some of the things are that are really kind of like unique or prevalent in Baltimore, because a lot of the patients do kind of live in the area as opposed to the other hospital, where I feel like people come in from a much wider geographic area. It definitely feels more like a community hospital where it's kind of serving the patients in the neighborhood. So it's kind of nice to get that feel while you're in Baltimore about just getting to know kind of the community a little bit better. I would say you also get a lot of kind of variety to kind of like immigrant populations or non-English speaking populations. I would say that is fairly common there, especially Spanish speaking patients. So just provides a slightly different experience as well.
The hospital is also about half the size of the downtown campus, and it is fantastic because you can round in about half the time. It's wonderful.
Yeah, it's a nice compliment because that the downtown hospital, it's so big, it's almost like multiple hospitals put together. But Bayview, it feels very much like a community single hospital. The team rooms are all very closely located, so it's easy to go by and talk to the residents, and it has much more of a kind of a community vibe. And it's also nice where the fellows office is. It's in a separate building, but there's a lot of the staff and other offices are there, and everything's kind of co-located. So you run into people. So it just feels like it's got kind of more of that sort of community vibe, which is really nice. And just to kind of further emphasize, I think one of the things I've been really just surprised about it, and it's really neat and interesting in Baltimore, is just how much it's a city of neighborhoods, and the geography and the patient populations can be so varied. Even the hospitals are only a few miles, apart, that you can get different, kind of distinct patient populations that you see at either hospital. So it adds some nice variety. And my clinics at Bayview, we have a continuity clinic that we do basically once a week, a half day. And I really like having clinic there, and just the patient population, and a lot of local Spanish speaking population that's there. But then there's also, just kind of a really great diversity of people that we see. So that's a really good clinic. Maybe, thinking more that we could kind of talk about some of the clinic experiences. I think we've probably had maybe some different people have been in different clinics here, so I'd like to hear people's experiences with that.
I'll just add one more thing about the inpatient services. One really nice thing both at Bayview and at on the main services, we have a clinical pharmacist who will typically round with us every day, which is really, really helpful. Learn so much from them. They're really helpful for kind of thinking about, which antibiotics you're picking and whether it'll work for whatever you're looking at, making sure their patients are on the right dose. So I think it's both really good for clinical care, and it's really good when questions come up because they have a lot of expertise as well, and teach us things all the time. And that's something both at Bayview and the main hospital.
And if they're not physically in the room with you, they are easily reachable by phone. Everyone has their number. They are truly fantastic.
And then, sorry, we can talk about clinic.
No, that's good.
So I guess Seth had mentioned Bayview Clinic. So in your first year of fellowship, you'll do continuity clinic half day per week, even while you're on service. And you'll either be assigned to Bayview Clinic or at Green Springs Station. So that is a general ID clinic at both those places. So like Seth said, the Bayview Clinic is really nice because you do see a wide variety of things there. I think, like Kate mentioned, you do see some local cases or things that are more prevalent in the local area. So I'd seen quite a few cases of like Amarinum while I was in clinic as an example, which was interesting. And then in your second year, typically you'll do HIV clinic as your continuity clinic. and that's at the Bartlett Clinic. So each fellow will have a panel of patients that they follow throughout the year. So it's nice to have that continuity with patients, and your attending who's precepting you in clinic has been following these patients typically for many years. So they're well aware of the patients and really know their needs, et cetera. But it's a great learning experience for the fellows there as well.
Yeah, I can comment a little bit further, particularly on the HIV clinic, because that's what I'm currently doing. Really, a fantastic experience. As Gerald said, it's really spans the gamut of people that have been followed for decades and have the classic, numerous resistance profiles. Their regimens are, tailored for very specific reasons. But then you also have people that were, recently diagnosed with HIV. And so you work through kind of the initial workup, what you're going to start them on, and presumably they have far less resistance. But I think it's important to kind of understand, that spectrum of HIV management. And then beyond that, to understand all of the kind of health maintenance that goes along with all of for all of these patients, which is immensely important.
Yeah, and also as a part of Bartlett Clinic, there is also an HIV curriculum that they typically have during your second and third year. For third years, it's optional, but during your second year, it sort of complements what you do in Bartlett Clinic. So every other Friday, typically we'll meet and just go over different topics in HIV, going through the fundamentals, whether it's resistance, new starts of medications, and we go through every class of medications sort of to become familiar with that also. So it's really helpful to do that and sort of get some fundamentals, and more so just it's a sort of a lecture, but also a discussion. So it's a safe place to ask questions. So I think it's a great learning opportunity there too.
And then Green Springs is the other clinic that you might have during first year. Probably overall a relatively similar experience to Bayview, just, slightly different patient population because it is located a little bit outside of the city of Baltimore. It's kind of more in a suburban area. But you still get like a lot of follow-ups from patients who are recently seen at Hopkins, sometimes Bayview as well. So you'll get like experience kind of managing patients while they're on their finishing like their outpatient course of IV antibiotics, or kind of just a lot of bread and butter outpatient ID as well with patients with like recurrent UTIs or latent TB or things like that, and sometimes kind of more exotic things as well.
And kind of talk a little bit more about the HIV experience. So one of the other services that we have, there's actually an inpatient HIV service where the primary team, it's an ID attending, and then you have residents. And then as the fellow, it's probably one of my favorite rotations because it's all the best parts of medicine where you're teaching the residents and learning about HIV, but not having to worry about a lot of the other parts of medicine that sometimes aren't as fun.
You don't have to write notes.
You don't have to write notes. Yeah. Yeah. So that's a great, and it is really fun. It's each afternoon you get to be doing a chalk talk with the residents, but then also learning about complex HIV regimens. I think there are very few places that still have like a HIV inpatient service, especially when staffed by an ID team. So that's a really neat to get to be the primary. I think after being a consultant for a while, sometimes you miss those aspects of being the primary team, and so you get to have some of that. And then also, just get to learn so much from that. So I think that's a really unique experience that's called the PULP service, but it's the HIV inpatient service that we get to do. I think too, just one of the things to think about as people are, picking fellowships is to think about, the geography and patient populations. And, if people are interested in HIV, there are, a few places, in the country, where there still is an HIV epidemic, and there are still, patients that are being admitted with, acute HIV. Unfortunately, here in Baltimore, we do see a fair amount of that. So I've seen many more cases of HIV than I did, in residency. And so I think from a learning perspective, especially if you're interested in care of HIV, I think it's a really good experience, that and the clinic that we're talking about. I don't know if anybody has any thoughts on the PULP service or.
Yeah, one thing I'll add about the PULP service is, at least the times I've been on PULP, typically the attendings give you a lot of autonomy also, and let you be attending basically, or pretending, if you will. So it's nice to lead rounds typically, and you sort of have a lot more autonomy there while they're still there as backup and sort of give their input as well, especially on complicated cases. So it's a nice opportunity to sort of step inside a leadership role as well.
Yeah, and I think in terms of thinking about the clinical experience, so there's the clinical, like being on the different clinical services, which is, most of your time and your clinical learning is coming just from doing consults and seeing consults. But then one of the things that our program has is there are structured didactics. So we have lectures, but then there are also conferences that we have that provide the opportunity for additional learning. It was curious if people had thoughts about kind of some of the different conferences that we have and maybe some of the didactics and how that kind of relates to the clinical experience.
So I guess I'll start by saying that there is a summer core curriculum, which is a nice way to start the year. So typically at the beginning of each fellowship year, they'll have a lecture series on Mondays and Fridays during noon, or Fridays might be in the morning. I think some years it may change, but throughout the series, basically they just go through a lot of fundamental topics within ID, whether it's just fundamentals about antibiotics, then they'll go through, say, UTIs, pneumonia, et cetera. So it really equips you well when you go on service or as you're starting fellowship to just understand some of the most fundamental things about ID. So I think that's one of the really helpful didactics that we do have.
And then there's a management conference every week as well, where it's with fellows and then also with many of the attendings. And its purpose is to discuss kind of difficult or challenging cases. So that is really interesting as well, because you kind of get to present interesting cases that you're seeing and then get the input from the rest of the division, kind of from faculty, especially ones who may be expert in particular areas on your case, and give you a lot more ideas of, like other diagnostics that you might want to try or other approaches to management that you and the attending you're working with may not have thought of. So that's really interesting as well. And I would say, especially kind of as the year goes on and you kind of get up to speed on more of the basic bread and butter ID, it becomes more and more interesting kind of as you're delving a little bit deeper into the more complex cases to kind of hear everyone discuss it and hear different approaches.
Yeah, and I think in general, the majority of the conferences are kind of targeted for, at least on the Monday conferences for sure, are targeted towards what, we would need to know either for, day-to-day clinical care or, perhaps what ID boards are focusing on. But then there's some of them too that are just focused on, kind of what the attending's research focus is, which is kind of cool because, I mean, they're leaders and experts in this area of research. And so to hear kind of what their thoughts are on the cutting edge of what's coming up is really kind of fun.
Yeah, and one of the other conferences, sorry, Seth. I was just going to say, one of the other conferences we have also is HIV conference on Friday afternoons, which typically starting second year, you'll probably attend those more. So typically it's framed as like a case conference, but sometimes, like say after CROI, they'll go through some of the major articles at that point as well. Things especially that are sort of guideline changing or practice changing, they'll go through. So it's a great way to stay up to date with things going on in the HIV field as well.
Yeah, I think just to summarize and echo a lot of that, I think the conferences, they just pair really well, with the clinical experience. I think one of the big things, there's so many things to think about when, picking a fellowship program, but the clinical training and the training that you're going to get as a fellow is something really important to think about. And it's especially thinking about it and looking for a program that is going to support your education and has a good balance between, the education and then the clinical service that you're providing and something and a place that tries to, really support your education. I feel like they do a really good job of that here in terms of, like Gerald mentioned, having caps on services so you're not too overwhelmed, with the burden of consults. I mean, they really encourage you to try to, to be there at all the conferences. I know, like, sometimes that can be really hard as a resident when you're so busy, but as a fellow and when you're really trying to learn these concepts, it's nice to have, that emphasis to make it to the conferences, to have the protection. As we mentioned, there's a solo service and they cover the pager kind of during the afternoon time when you're going to be in conference. And so that's really nice to have that weight taken off you so you can just kind of focus on the learning. that's there. So I think kind of throughout all these things, I think there's great clinical training, great, expertise, but then having, a division and a leadership team from the program directors that are really trying to, support you in your education is really important. I think that they do a great job of that here. So anything we didn't touch on, or anything that other thoughts that people have?
No, I think it's it's impossible to see everything there is to see in ID at any one, fellowship program, and that's completely fine. But I think what Hopkins has done is, shown me a lot. I think, certainly I've been exposed to the majority of what I need to be exposed to. Pun intended, I suppose. But I think more than that, they kind of give you the resources of, when you come in, when you see a patient and you're not, comfortable with the differential, or you're not sure what's going on, they provide you with what I think 60 faculty at your fingertips that, you could feel comfortable reaching out to discuss a case with. And I think that is important when you're looking for a fellowship program, because it's the start of, your networking and building your group of colleagues that, as you go forward in your career, you're going to look to them for advice and support and kind of just someone to discuss a case with. So I think just knowing the diverse faculty group that we have is important and helpful when you're looking for an ID fellowship.
Yeah, I'll definitely echo that. I think one of the best things about the program is no matter what service you're on, there's definitely someone you can reach out to for expertise and whatever that specific organism is, whatever that specific scenario is. So that's a really great resource. People who are writing guidelines are here, and there are people you can reach out to, and they're more than happy to help, and they'll get back to you right away. So that's a really great resource. And like Seth said, one of the other things that I really like about the program is there is this emphasis on education, and the protected time by having a solo attending and having caps really helps emphasize the time, gives you the time to go to conferences and not just get overwhelmed with, say, the pager. So I think those are some of my favorite aspects of the program.
Yeah, overall agree with pretty much what everyone else has already said. I guess I would just say that in addition to just like protecting your time and like putting caps on work, I would just say that for the most part, there's a very just comfortable learning environment as well. Like all of the faculty are very approachable. Especially early on when you may feel like you don't really know anything, no one makes you feel stupid at any point. Everyone is very, very supportive and lets you ask questions and talk through your thought process, which is something that I think is really helpful, especially first year.
Yeah, I think it's been a great experience, and kind of going on the trail of support and networking, things like that. If people have questions, definitely can reach out to any of us. People, when I was interviewing, were so helpful in terms of answering questions, more specific details or comparing things. I think any of us would be helpful to talk to applicants. To feel free to reach out to us. And the ID world, you realize more and more it's a small world, and so we'll all run into each other at some point. And so it's just nice especially to hear from applicants and people who are excited about ID and get to talk about the experience here. So happy to share more. But I think we covered a lot of things, and so appreciate everyone's time. And I'm sure they can get our information and reach out to us. So